Okay, I think we'll start. So, good afternoon, everybody. I'm Martin Elliott, and I'm going to be chairing today's ExChange webinar. I'm really pleased that we've been joined by Dr. Calum Webb from Sheffield University, who's in the Research Methods Institute, and he's going to be presenting on his work around investment in prevention and support in children's services. Presentation will be around about sort of 30-40 minutes, and so we've got enough of an opportunity at the end for you to ask questions or make comments. There'll be two ways of doing that. Either if you're happy to ask your own question, if you can hang on to that question till the end, and we'll get you to raise a virtual hand and I'll come to you to ask your question. If you'd rather not, I can ask a question on your behalf, and if you use the Q&A button at the top of the bar to put your question in there, and then I'll put those questions to Calum once he's finished his presentation. So I'll hand over to Calum.
Thank you, Mart. Hi, everyone. Thank you, first of all, so much for inviting me. And secondly, so much for attending on such a lovely, I'm assuming where you are, it's also beautiful and sunny and about 25 degrees outside. So I'm hoping that many of you are able to sit in your garden or something and have lunch while attending this seminar. But yeah, I'm really grateful that everyone's found the time to attend. So as Mart said, I wanted to talk a little bit about a research study that I've been conducting for the last 3 years. It just finished around last November. So I'm just starting to put some of the findings out there and publish some of the findings. It was a study about data that was in England, unfortunately, just England. There wasn't Welsh data in there, but I'm hoping in the discussion we can have a conversation about what the implications are for Wales as well. You know, there's lots of similarities with the data, but also lots of differences. And lots of different approaches and lots of different responses. This was a study that was funded by the British Academy, and the main challenge with this study was a methodological one, but I'm going to try not to talk too much about the methods and focus on the findings. A little, I guess, comment on how I'm going to be using some terms in this presentation is I will tend to use the term effectiveness when I'm talking about if you put a certain amount of money into, if you invest a certain amount of money into preventative services, by which I mean children's centres, family support, youth centres, youth clubs, to what extent does that lead to reductions in rates of children on child protection plans, or rates of children in need, or rates of children in care, rates of children who are looked after? But I just want to make it really clear that that's not the only definition of effectiveness. There's lots of other really important things that make up effectiveness in these kinds of services. And that's not what this study was about. This study was about a very small part of effectiveness in terms of funding and investment, but there's lots of other things that are important to keep in mind around making sure that services are offered to support families and children's rights, that they hear the voice of parents and children and other family members, that they challenge inequality and oppression and all sorts of other things, or even, you know, effectiveness in terms of how well they keep to procedures and processes. So we're just talking about if money is spent on services, does that tend to increase or reduce rates of intervention? I think I don't need to spend too much time defining the kind of outcomes I was looking at. This is more of a slide for whenever there's a international, by which I mean outside of the UK, policy audience, but I was looking primarily at children looked after rates, child protection plan rates, and children in need rates, child in need rates, and then preventative services spending. Here I was looking at the expenditure that's reported in the Section 251 outturns, and one of the ways to try and improve the comparability when using this measure is to combine lots of these categories that local authorities sometimes use in different ways. I'll talk a little bit more about the methodological challenges. But briefly put, the way I'm defining preventative services here is spending on children's centres and services for children under 5, family support services, services for young people, which includes youth work, youth centres, substance misuse and pregnancy, teenage pregnancy services, and then other spending that's not related to children being looked after or safeguarding, which includes sort of direct child protection and social work, or safeguarding commissioning, or youth justice related services. So historically, this has been quite a difficult category to use, because if you look across different local authorities, they will often use these categories slightly differently. Combining the categories helps. If something is preventative, more or less most local authorities put it under preventative. They don't tend to sort of put it under looked after or put it under safeguarding. But of course, there's variation. One of the ways that I tried to account for this in the study was by using these not necessarily new models, but models that are quite new to children's social care research, called within-between models. And to talk about that very briefly, it's about separating out what happens when you're comparing between local authorities from what happens when you're looking at changes within local authorities over time. So we usually expect that what happens within a local authority over time is a bit more consistent than if you're trying to compare Blackpool to Sussex or wherever, Sheffield to Exeter. So we're focusing, or I'm focusing in this study more on what happens within Sheffield over time, Exeter over time, and less about the differences between Exeter and Sheffield and Blackpool and wherever. That's important because if you're comparing between local authorities, it tends to be the case that if they spend more money on services, it's because they have higher needs. So the causality is actually the opposite way from what we would expect it. They have more needs, so therefore they get more money. But we're interested in, when they get more money, what happens to their needs. So that's why we're looking within the local authorities. I'm not going to go through all of these things because some of them are a bit more technical than others, but I was looking at data all the way from 2009-10 through to 2021-22. That was the widest range of data. Comparable child poverty rate estimates are only available from about 2014-15 to 2021-22. So there were two separate analyses, one with a slightly longer time span and one with a slightly shorter one. Anyway, that's more than enough methods. I'm sure you're all interested to hear about the findings. I'm not going to put the conclusions all the way at the end. The first, probably most important finding is that the evidence is quite strongly suggests that investing in preventative services reduces rates of children looked after and children on child protection plans. For children in need, it's a little bit more tricky in that when you put the spending in, initially the numbers of children in need go up, presumably because the thresholds can be lowered. But then the following year, the number of, if you maintain that spending, the following year, the number of children in need go down. So there's sort of like a self-correction type thing. But in those data periods, it's more like the thresholds change. So that's probably a good thing because it means more children and families are accessing support. What that looks like specifically, since we've mostly experienced decreases in this spending, we'll talk in terms of decreases. Every £100 decrease in family support, youth services, children's centres per child within a local authority was associated with an increase of around 3.5 children in care per 10,000 over the following 2 years. And that's mirrored to some extent in children on child protection plans. You'd expect about an increase of 2 per 10,000. If you don't like per 10,000 and you want to think about an average sized local authority, that's about 20 more children in care, or 10 more children placed, and also 10 more children placed on child protection plans. On a given day of the year, we assume that the March 31st rate is fairly representative of any date you could pick. That may or may not be a good assumption to make, but I think it's a reasonably fair assumption. And if we map that on to the changes in spending we've seen, and this is one of the reasons it's so important, I think, to go all the way back to 2009-10, is that the biggest reductions in this type of spending were made in those first few years after the financial crises. You can see that between 2010-11 and 2011-12, that 71, almost £72 per child decrease in the funding of these services would be associated with about 25 more children. This one's per 100,000, so 2.5 per 10,000. Just to make the graph look a bit nicer, that is increase. And those changes, those reductions in spending on preventative services can explain about 60% of an average local authority's increase in children looked after rates between 2009-10 and 2021-22. So if you looked at the actual average increase and then you looked at what you'd expect just from the estimate that we have for how much preventative spending would impact that, you get about 60% of the way there. Now, what's really important is that 60% is also a little bit muddled up with the impact of poverty. So the 2014-15 to 2021-22 analysis sort of unpacks that a little bit more. Before I go on to that, if we are slowly working our way up from per 10,000 to per average size local authority to thinking nationally, nationally in England in this case, that the overall reduction in spending on these services, so if you compare 2009-10 to 2021-22, we're spending about £212 less per child per year on average on prevention. We'd expect then that there's about 8,300 more children in care than there would otherwise be if we had kept our spending the same as it was in 2009-10. That's about 10%, so quite a significant number. Probably significant enough to have avoided the annual increase overall in numbers of children in care that we're seeing per capita. If you look at the proposed uplift from the 2022 care review, then we would expect, it works out to about £1 billion per year investment in family support. We'd expect that to reduce the rates by about 3,500. So even though £1 billion per year sounds like a lot of money, it's not, well, it's literally less than half of what we've cut from this type of spending since 2009-10. And it's really easy to lose perspective if we just look at the more recent years, because it's easy to underestimate just how much was cut in the first few years of the coalition government. If we look between 2014-15 and 2021-22, when we can kind of incorporate poverty into this model, and if we work on the assumption that these kinds of preventative services within local authorities also help address poverty. For example, if you have a youth club, it increases the amount of either heavily subsidized or free childcare that families have access to, which increases opportunities for employment, opportunities for working additional hours. Or if you consider the kinds of benefits advice services or other things that often are available within children's centres or in family support services, then you can get a better picture of that combination between that combination of how poverty and spending affects child welfare interventions. So I'll skip a bit through this and just show you this graph, because I think the graph makes the point a little bit more clearly. If you repeated that same forecasting task from earlier, where you're looking at the average local authorities increase in rates of children looked after between 2014-15 and 2021-22, about 2/3 of that increase is attributable to increases in child poverty. So this really reinforces the messages from the Child Welfare Inequalities Project that Mart was a big part of, and that Jonathan and lots of colleagues at Cascade, lots of colleagues at Cardiff were involved in. The major contributing factor to increases in rates of children in care is child poverty. Then about 1/3 is associated with spending in some way or another, associated with preventative spending. So in the darker green is what we call an indirect increase. So that's the average increase in rates of children looked after that we expect under this model is associated with the impacts that these kinds of services have on reducing child poverty. So this is sort of the poverty, whichever you want to use, poverty aware work, anti-poverty work, types of support that are offered by preventative services. And then you have this smaller chunk, which is the sort of direct contribution of services of these preventative services. So this lighter green chunk is related to the benefits that preventative services have above and beyond their ability to reduce child poverty. And then at the bottom, we have a slightly stranger thing going on that I'll unpack a little bit towards the end of the presentation, which is that actually, as time has gone on, spending on these preventative services has actually started to increase the rates of child protection plans and children in need rates. And its effectiveness has shifted more towards the later intervention side of the scale. And I'm sure there's lots of really interesting discussions we can have about that, especially from people with practice experience or people who are practicing social workers now. I'll preface this by saying I'm not an economist. I have made some very, very conservative sort of cost benefits, value for money type estimates. These are very difficult to estimate, and I do want it to be really clear that even if spending money on preventative services wasn't cost effective, that doesn't mean we shouldn't do it, because we also have a moral and human obligation to support families. I think as a society, people are broadly supportive of that, especially supporting children. But for those of you who are working in the policy space, I'm sure you know that it's really important to be able to demonstrate that even though these services are effective, they also offer value for money. So if you're thinking just about immediate children's outcomes, so I'm not even talking about the outcomes for a whole childhood from birth to 18, I'm talking about outcomes for children in the span of 1 to 2 years. You would expect about 30% of the costs of funding the services to be returned through those reductions of children in care. That's assuming the average cost of a child being in care per year, about £77,000 a year in England. But also through improved mental health outcomes. And again, I'm being quite conservative here. I'm estimating that the mental health outcomes for those children change from the outcomes for children in care that are exceptionally poor, down to the outcomes for children who live in deprived households, and also criminal justice outcomes. And again, here I'm not assuming that these children who are prevented from going into care, suddenly they have a very typical average childhood. We're working on the assumption here that their criminal justice outcomes reduce from the outcomes for children in care to the outcomes for children who are on a child protection plan but have never been in care. So that work's very new work. I believe that may have just been published, or it's imminently being published, by Dr. Anna Leyland, who's at Manchester Metropolitan University, who's done some really, really brilliant research breaking down criminal justice inequalities, not just between children in care and children who are not in care, but also children who are in need, children who are on child protection plans, and so on. So on the most conservative estimate you can have is that there's about 30% of the costs we'd expect to be returned. If you then look at the impact that we'd expect these kinds of services to have on child poverty, and you use the cost estimates from the Child Poverty Action Group, which I believe were developed by Donald Hirsch, and I think Donald's work is just brilliant, so I have no reason to doubt the quality of these cost estimates. You would expect about £2.75 of every £1 spent to be returned through the kinds of healthcare, well-being, education, etc., employment outcomes that come from addressing child poverty. So my takeaway from those cost estimates is that it is very, very, very likely that spending money on these kinds of supportive services is at the very least cost neutral, and more likely than not saves money. So hopefully that's a useful, beneficial argument to be able to make. The rest of the findings I'm just going to talk about very briefly, and if anyone wants me to expand on any of them, please do ask a question in the Q&A, or offer to ask a question in the chat. But I'll also put a link into the project website where you can read a little bit more about these findings. So the first one, which I think is relevant for anyone who either works directly with safeguarding teams or works in safeguarding, is that you can't just replace preventative spending with safeguarding spending. So what a lot of local authorities in England have done is their preventative spending has gone down a cliff. But to try and manage the increased demand associated with that, they have increased a little bit, not loads, but they have tended to increase their safeguarding spending. So this sort of, the response has moved up the thresholds, up the levels of intervention. We're no longer preventing things as much, but then we're trying to keep our investment in the safeguarding aspect so that when those problems that we didn't prevent escalate, as many of them will, we hope to have some capacity in social work to deal with those. Unfortunately, social workers need preventative services, or the data suggests that social workers need preventative services. If you have a situation where on the left here, where it says -200, if you have a situation where spending on preventative services is very low, much lower than the average for that local authority, and then you increase your spending on safeguarding services, what the data suggests tends to happen is you then end up with actually a lot more children taken into care. This would estimate about 7.5 per 10,000 more children taken into care for a £100 per child increase in safeguarding spending. So direct social work safeguarding spending. But if you have quite a well-resourced set of preventative services in the years where local authorities spent about £200 more per child on prevention, if they increased their safeguarding spending in that context, it didn't really have any impact, or it wouldn't be expected to have any impact on the rates of children who are in care. And if we tear ourselves away from the statistics and the graphs a little bit, that kind of makes some intuitive sense. If there's a lot of funding of preventative services, and social workers also have a lot of funding, then you would hope it gives them more routes to sort of provide services for families, provide opportunities to manage any risks, to make any kind of child protection plans, for instance, more likely to address the risks that are perceived within the family, because there is available provision of family support, available provision of children's centres, available provision of youth work, and so on. So you essentially need both. Of course you need both to meet your statutory obligations, but you can't just fund your social work services and expect that to reduce rates of intervention when social workers don't have sufficient resources around them to support families. But it's also really important to consider that the impact of prevention hasn't been consistent across lots of different years. So a little bit, like I mentioned earlier, if you look very early in the decade, 2009-10 to 11, 2011 to 12, and you look on the sort of left-hand side of this graph, you can see that all of the distributions, this is the predicted effect, they're all green. If you're not a very statsy person, green means good. And the closer the dots are together means it is better. It means local authorities are having more consistent outcomes from their spending. So more green is better. Closer together dots are better. In the early part of the decade, there was quite a lot of evidence to suggest that spending on prevention worked really well for reducing children looked after rates, child protection plan rates, and children in need rates. And it worked in kind of a similar way, or a more similar way, across all of the local authorities in England. And then in 2011-12 to 2012-13, we have the big funding formula changes. All of a sudden, the funding for these services is not so strongly correlated with the needs of the population. And all of the impacts become a lot more variable across all of the local authorities. And then we enter this period of time between 2013 and 2017, where the funding of these services isn't very effective for reducing rates of intervention at all across the board. And now we're sort of in this era, I guess, maybe a bit too grand a word to use, where spending on these services does seem to do quite a lot, increasingly a lot, to prevent children from entering care. but it struggles to bring the risks down below that child protection plan level or the children in need level. So the impact it's able to have is much more at the level where children are maybe at risk of being placed in care. And that's not necessarily a situation that we want to maintain, children that stay or repeatedly end up on child protection plans, or having a very large child protection plan or children in need population. I probably don't need to give anyone here a potted history about all of the things that have changed over time, but presented without too much comment are lots of different policy initiatives and changes and significant things that have happened over that time period. And it's important to think sometimes these changes, for instance, in this sort of middle time period where there's very little effectiveness, may not necessarily be because the kinds of policies that were being implemented were bad, but it could just be because lots of things were changing. And when things change, it tends to take a while to see the effects. And the last thing I'll say before we open up to questions is just a quick comment on variation across the country, but also variation across different groups of children. So if we look at England, again, sadly, Wales is all greyed out, Northern Ireland is all greyed out, Scotland is all greyed out. Martin and I, I'm sure, can tell you very well the challenges of, and I'm sure other people on the call as well can tell you the challenges of getting comparable data from the four nations. Fortunately, Wales and England are more similar than to each other than Scotland or Northern Ireland are to any of the others. But on this map, you can see that all of the green areas are areas where, when the spending has decreased, there's been big increases in rates of children looked after. That can be interpreted in different ways. That could be interpreted as what they were doing was very effective, but it could also be interpreted as there was a very strong reliance on those preventative services, or those preventative services maybe, or rather the entire service maybe wasn't so resilient to losing that funding for good reasons or bad reasons. So you see a lot of variation. In London, you tend to see it being a lot more of a complex picture. The orange here would reflect if more money is spent on preventative services, you would expect there to be more children in care over the following 2 years. So again, that could suggest lots of things. If that's identifying children who would really benefit from being in care, then that's not necessarily a negative thing. But it could also indicate that maybe there's a challenge with balancing being able to identify risks and concerns within families and for children, and being able to address those risks and concerns. I think that's the biggest challenge facing all kinds of child protection, be it preventative or whatever, something at the very, very high end of intervention. I'll skip past the child protection plan and the children in need rates. Those again are very different. One thing that's really important to note is that it's very, very rarely the case that a local authority's spending increases every type of intervention or decreases every type of intervention. It's usually a mixture. In some local authorities, if they spend more money, it tends to reduce their child protection plan rates a lot, but maybe it doesn't do so much for their children looked after rates, and so on. And then very briefly, and then I'll stop because then we're at 40 minutes, I think. If I talk to you very briefly about the differences between different groups of children, if we are looking at child populations by age, the children or the groups of children who have been most affected by reductions to children's services have been the older children, so 10 to 15-year-olds and children who are 16 plus. And that's not massively surprising when we consider, if you look at the cuts to youth work and youth services, those have been more like 75%, 3/4 of the funding has been reduced. Whereas if you look on average across all child groups, I think it's probably closer to 30 or 40 or 50%, something like that. So, for some groups, there's a lot more funding available. Some of that's linked to sort of early intervention initiatives and so on. But really, it's the older children who have lost the most in terms of their services, and it's the older children who these services tend to have the biggest impact on. If we're looking at gender, it tends to be boys and young men who benefit more from these types of services. We could probably talk about the reasons why that might be, but that may, of course, be linked to the types of risks that are associated with children according to their gender. And lastly, if we look a little bit across different ethnic groups, you see in general spending on these services is effective. So I'm looking at this combined estimate here, the 0.983, 0.951, and so on. Spending on these services is effective for reducing rates of intervention across all ethnic groups, but it's markedly more effective for reducing rates of intervention, or there's a much bigger linked effect with children from Black African, Black Caribbean, Black other backgrounds, children from, this predominantly means South Asian backgrounds, or children from mixed heritage backgrounds. So I'll stop there. I know there's like all these slides that I haven't talked about, but the link to the slides will be shared, and the link to the website that has sort of an extended research summary will be shared. But yes, I am looking forward to hearing people's thoughts about the findings and also answering any questions there are. Oh, I'll also, if it's okay with Martin, I know Martin as the chair has promised to be strict. But if it's okay, I will also share very quickly what the website looks like. I think if I share my whole screen, apologies, Mark, you'll flash up very briefly. So if I share my whole screen, the website looks a bit like this. If you are working with colleagues in England, again, it's not so helpful for you in Wales, but if you want to look at that variation in your specific local authority, there is an app that unfortunately takes a little while to load, but if you're patient with it, it will eventually load, I promise. He says while it struggles to load. Yeah, here it is. So what you can do on this app is you could put in, for example, Liverpool, who I always like to show because they're a very positive story. And you can see what the predicted effect is for investment in Liverpool. You can see how it compares to other local authorities and which places are similar to each other. And then you can also see, for example, the breakdown by age group. So here in Liverpool, the biggest effect is for the older children, but also Liverpool seems to have a very beneficial effect for children aged under 1 year. So I'm hoping that will facilitate sort of policy learning across local authorities. If one local authority, it seems to have a big impact on under ones, and in another local authority, it maybe doesn't. Maybe they can find out what's being done differently. Yes, I'll stop talking now and take questions, if that's okay.
Brilliant. Thanks ever so much, Calum. You covered an awful lot of ground in 40 minutes there. Somebody's asking, can you tell us a summary of the analysis of data from Wales and if there are any key differences to what you found in England?
I think, is that a question for Helen? I saw Helen put in the chat about a replication. Is that a question for Helen, or?
I think it's something we could get Helen to talk to if Helen's willing to come on.
Hello. Can you just acknowledge you can hear me because I'm sat
Yes.
in the office? Okay, brilliant.
Yeah, that's fine.
I haven't got my proper headset. So what the first thing to say is trying to replicate this for Wales was, or even a little snapshot of this for Wales was incredibly difficult. So Calum mentioned a particular return which has the finance, and that relates to a piece of legislation which is only in England. So we had to use the RO3 finance returns, and you can get those for England as well as Wales. So that's what we attempted to do. And we also looked at things like deprivation. There are, for people who are not aware, there's the IMD for England and there's the WIMD for Wales, but there is actually a combined data set which allows you to look at things like a DACI across the, I can't remember the exact number, the 34,500 and blah, 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 what number of LSOAs in England and Wales, and then produce an extent measure. So that's what we actually...
Helen, can
yes.
I just get you? You used an awful lot of acronyms in that.
Yes,
do you want to just explain what some of those are?
Of course. So WIMD and IMD are the indices of multiple deprivation, and they tend to be produced at an LSOA, so a small level, a small geographical level, and we have those across England and Wales. Scotland has a slightly different name for them, and there's also a Scottish indices of multiple deprivation. We have 1,909 LSOAs across the 22 local authorities in Wales. What we can do is we can use an extent measure which says, okay, what portion of the LSOAs in a single local authority area are in the top 10% most deprived? And that's a convention that's used quite a bit in England, and we tend not to use it in Wales. But I've done that so we could look at the extent of income affecting child deprivation, DACI, across all the local authorities in England and Wales. And that allowed us to kind of look at spend per head in each local authority. We tried to look at change in spend over time. We couldn't go back as far as Calum, looking at 2009-10, simply because the RO3 returns didn't allow us to go back that far. So what can be found from that is that we have a lot of debates usually around Wales is so much more deprived than England, and that's the reason we have higher rates. However, it's not necessarily about that, and a lot of the issues that Calum touched on about preventative spend and all these different types of spend are things that potentially came out as issues, but we haven't got as much data. We only have 22 local authorities to be able to drill down to the level of kind of who spent what in different areas. But it just gives you a very brief context of why it's so hard to replicate this and do comparisons across the two nations. I do think Calum's work is absolutely fantastic, and I really wish we could replicate it in Wales. Some of the conclusions we came to are things like Hillingdon, I hope I pronounced that correctly, the local authority where Heathrow is, and also Croydon, where there's an assessment centre for age, and so we have a lot of kids there. And then there's also a local authority in Kent, which I want to say is near the Dover one. Some of them had seem to have very, very high rates and the spends, and that would be linked to the number of migrant children, that are unaccompanied asylum-seeking children that are coming in. And we've seen debates about, I can't remember exactly what the wording is, there was a kind of limit to the capacity of the local authorities to support that number of children. And they wanted them to be dispersed more widely across both nations, so it didn't put such an extreme drain on resources. So that's probably all I've got to say about our work, but I hope it's been useful in the context of this discussion. Calum, big fan. That's all I'm going to say. It's amazing what you've done, and I do wish we could do it in Wales.
Brilliant. Thank you, Helen.
Thanks, Helen.
Now can we go to Valerie, who's been patiently sitting with her hand up?
Hooray, I'm here. Yeah, it was interesting, Calum. I actually work for a preventative service in Newport, so it was very interesting to see your findings. And we come under Families First in Newport, and that is the sort of funding stream in Wales. So my question is, how much of this is due to funding initiatives like Families First in Wales, don't know what the English equivalent is, or how much of it is down to personal choices that local authorities make with their budgets?
Thanks, Valerie. I think that's a really important question. One of the things that's not in my presentation, and also please do anyone chime in the chat if you know the equivalent to Families First in England. I have probably an educated guess of what it would be, but I wouldn't want to make that educated guess in case it's wrong. But I do think it's very interesting, even though maybe in this analysis we're a little bit too cautious about combining spending categories rather than looking at them split out and seeing, the variation between what they spend their money on. But one thing that's really interesting and wasn't on my slides, but it's on the website, is if you look at, if you sort of look at that breakdown of preventative spending on children's services in England. So if you look at the categories Sure Start and under 5, so sort of children's centres broadly speaking, family support services, which includes your Troubled Families Programme, which is now called Strengthening Families Programme, but I think is largely the same thing, just framed in slightly less diminutive language. And then your young people services, which is your youth work, your youth centres, your teenage pregnancy substance misuse services, and then others not particularly instructive. But if you look at those 5 categories, only one of those has increased in total. So Sure Start and under 5s has gone down from 1.84 billion to 510 million. So, and it used to make up about 40% of the spending in national spending. It now makes up about 20%. Young people services, so your youth clubs, your youth work, that's gone down from 1.25 billion all the way to 420 million. That used to make up 27% of the spending. It now makes up just under 17% of the spending. I'll skip past other, but other is more than halved. So other went from 460 million to 120 million. The only one that's increased is family support services. So family support services, Troubled Families Programme, etc., has increased from about 1.07 billion up to 1.44 billion. And as a proportion, that's gone from making up just under a quarter of all of the spending on prevention to making up almost 60% of all of the spending on prevention. So we've changed from a system that's sort of almost equally split between children's centres, sort of more community level interventions, youth work, those kinds of things, to one that is predominantly casework and advice based, right? So, your Troubled Families caseworker is not going to be providing you with childcare, right? Their role is to help you access childcare, or help you access parenting program, or help you access youth services. But my concern is what happens when there's none of those services for them to point families towards. I'm sure they're all wonderful people who are working really, really hard to try and do things that help families, but they're almost in the same position as social workers. What do they do if there's no services for them to signpost families to? They're a little bit stuck, and it reminds me actually of, there was I can't remember which documentary program it was, but there was maybe Dispatches or something like that about citizens' advice, and they were interviewing the citizens' advice workers, I think in Manchester, and the citizens' advice workers were saying, well, 10, 15 years ago, if someone phoned up you could do quite a lot to help them, because usually they weren't claiming all of their entitlements. There were programs that they could access that they weren't getting access to. There were employment programs, childcare opportunities, etc., that you could point people towards. And now those same Citizens Advice Bureau advisors are saying they're having people phoning them up who know as much about benefits maximisation, local services they can access, etc., than they do. And they're increasingly in this situation where people phone up and they've done everything to try and improve their financial situation or their employment situation or whatever. And the advisor can't really suggest anything to them. So I have a real worry that, in the same way as if you spend lots of money on social work, but then you don't spend any money on prevention, the social workers have limited routes they can go down, that you see it at that level of prevention as well. If there's lots of money on casework and advice services, and like, I suppose, more intensive, like family focused rather than community focused interventions, you risk maybe losing some of the community level interventions that support that work. So I don't think that answers your question, but I hope it's, I'd be really interested to hear if it at all chimes with your experience and the kind of work you do. I know we're limited for time, but I don't know if Valerie wanted to come back.
It's very what you're saying, especially, and I'm just writing now, we're already seeing services closing due to funding. Because, and the other thing is, for Families First in Wales, which is a real pain in the neck, is it's year by year funding. So you cannot, we will be in the position, right, we got a bit of money in the pot, we can take a worker on, right, we can only take them on a temporary contract for 6 months because we don't know what our funding's going to be next year. And that is a bit of a nightmare. But yeah, thanks, it's interesting. And your gaps, your reductions were scary. Thank you. I
can only hope maybe they're slightly less scary in Wales, but in England they certainly are.
I wouldn't be surprised if they're the same, if not worse.
Thanks, Valerie. Can we go to Martin, please? Because he's had his hand up for a little while and we've only got a few minutes left. Martin.
Hi, thanks. 3 quick questions. First of all, I'm a public contributor to health and social care research and based in Cardiff, but I've also worked on projects that have involvement in England. I hadn't really clocked this important thing which has come out of your work on the difference between child safeguarding and prevention. And I'm as a member of the public, I'm always interested in impact. And I'm very conscious that the reason why a lot of these services are underfunded or losing funding is because of decisions taken by or largely influenced by people who are not experts in the field, people who are beyond social services, people like chief executives and other people in the local authority and councillors. And that brings me to the second point, really, is, has there been any thought anywhere, and I wouldn't be surprised to have, at the very least, even qualitative research looking at things like the sort of environment in which these senior decision makers work? Just over 15 years ago, I was benchmarking, nothing to do specifically with this area, but just generally local authority and other organisations' use of risk registers. And I first came across, in one local authority, it was actually in the Greater Manchester area, that the only social services risk that appeared on the top level risk register, i.e. the one that the chief executive took the most notice of, was deaths of children who were sort of in the care of the council, whether on the risk register or in care. And that's what drives a lot of the decision making on, so I'm not surprised, not just the legal duties, but also, if that's a risk owned by the chief executive, he's going to take more note, or she's going to take more notice of that. And finally, in Wales, we have this thing which is, the NHS is so much better funded, whatever they say, than local government. Doesn't mean it's used all that well very often, but and they're supposed to be about prevention as well. And is there any scope for NHS funded services getting involved? Because some of the impact of the problems caused by the lack of prevention it falls on the NHS to deal with, as well as other organisations. So anyway, I'm not sure. I'm sure you haven't got time to answer those, but just thoughts that cross my mind as a member of the public.
Yeah, thank you, Martin. I'm happy to give it a try, and I don't mind staying a little bit later, but later than the scheduled end time. But I perfectly understand if people need to go while I'm talking. I won't be offended. I suppose if I can come back on the two things there, I'm not familiar with any sort of qualitative research on leadership. I'm sure it's out there, but I'm not familiar with it. But I think something related to that point that I'm personally very interested in is the sort of role that the kind of sort of randomized controlled trials, greater emphasis on, gold standard, causally robust studies has had on the kind of fund services that get funded. And in the same way, the sort of emphasis on the first 1,000 days, which in the Allen reports, Graham Allen made very clear that shouldn't come at the expense of the other however many thousands of days. But when you then put local authorities into a situation where they have to pick between investing in the thing that someone says this is the most important thing and investing in the thing that someone says this is less important, obviously they're going to pick the thing that everyone says is more important. But I think that has been a case where you have a lot of very, very well-meaning people trying to improve the quality of the evidence about interventions. But I feel like when you're talking about children's social care, there's also a certain element of provision that is you just have to accept that you cannot do an RCT on it, you cannot do a randomized controlled trial on it, but that doesn't mean it isn't beneficial. So I think and I hope that over time we move towards a slightly more nuanced approach to, I'm not suggesting there's anyone out there saying we must only do randomized controlled trials and only fund things with gold quality, gold star standard evidence, but the kind of broader policy narrative sort of channels people towards that. And that's also where there is a little bit of crossover with quite a lot of that work is not necessarily being done by people with children's social care sort of backgrounds or experience or understanding, especially of the broader system, rather than the sort of more specific work. And then on your second point, which I had a response to, but sort of gone from my memory while I was trying to work through my response to the first point. Mark, are you able to jog my memory? Maybe it will.
We're actually we're a couple of minutes over the 2 o'clock finish, so I think we are probably going to have to round it up anyway. So I suppose the first thing to do is to thank you, Calum, for taking the time to come and present. It's really super interesting, and as Helen said, it's really important work. So we're really pleased that you've come to Wales virtually to present on it, and thanks everybody for attending and for questions and comments. So yes, thanks ever so much everybody for coming. Enjoy the rest of your day. Hopefully you'll be able to get out and enjoy the sunshine, and we look forward to seeing you at the next ExChange webinar.
Thank you everyone. Thanks Mark.